Concussion pathophysiology tells us that concussion is a result of acceleration-deceleration forces that get to the brain, and you can't accelerate the head or the brain without movement of the neck. So if we add all that up, we'll see that Hello, I'm Dr. Mark. I've worked with concussion almost exclusively for the past 5 years. I've cleared over 500 people from collegiate and professional athletes all the way to super loving and non-athletic at all grandparents and everyone in between. Here on this channel, we talk about concussion rehab, getting rid of symptoms and getting you back to work, school, sport, or just your regular life. Today in particular, I wanted to talk about how easy it is to get a concussion. This concern is probably one of the top reasons for stress and anxiety in folks with post-concussion, really in anyone, because they don't want to reconcuss themselves, especially when they were like this close to recovery and feeling normal again. So as you'll hear me say a lot on this channel, fear not, we're actually going to talk today about how hard it is to get a concussion. We'll also talk about another injury that walks, swims, quacks like concussion, and it's not a brain injury. And we'll talk about how to tell the difference. So we're going to get surface level nerdy here for a minute. Let's define a concussion. A concussion is a form of mild traumatic brain injury, and it's caused when we have acceleration and deceleration forces get up to our brain and our skull. So think about like a car accident where the seatbelt's holding you back. Think about football helmets clashing together. Some sort of force is transmitted to the skull or the brain. And when we think about the force required for a concussion, we actually can pull from like football helmet sensor data. So I use the football analogy there. But when we look at football helmet sensor data and we see, okay, what were the forces? And among those forces that were collected, how many of those impacts actually resulted in concussion? And so if this person got diagnosed with a concussion over here, what was the force they sustained in their helmet over here? And all this is kind of bringing us to nerdy G-force. So the force of gravity. Let's contextualize concussion forces relative, like in G-force, relative to other things that you might actually experience. So just sitting here watching this video, you're experiencing 1 G. 1 unit of gravity is kind of holding you down here on Earth. Thank you for that. And that's 1 G of force. A sneeze, like this hearty open mouth sneeze, that'd be really gross and kind of throw spit and boogers everywhere. That would be about 3 Gs of force. I think it's like 2.9 Gs if you want to be technical about it. A hearty slap on the back might reach about 4 Gs. Whiplash, so cervical strain or sprain, is going to be about 4.5 to 5 Gs. So right around 5 Gs of force. When we get to concussion, that's 60 to 160 Gs of force. Depending on the study, you'll see a range of like 70 to 120, 60 to 160, but let's say 60 to 160 Gs of force. There are also rotational forces at play. So we measure these in radians per second squared. The range is 5,582 to 9,515 radians per second squared. For perspective, that's about 53,000 to 91,000 revolutions per minute. And a Formula One race car can only go up to about 20,000 revolutions per minute. Only. So concussion is a massive force. Concussion forces are higher than a Formula One race car. And more importantly and contextually, concussion, maybe not more importantly, but more relevant for people to understand, is that concussion forces are about 15 to 32 times more than the force required to sustain whiplash or a cervical strain and sprain injury. So let's pause on that for a second. Concussions occur between 60 and 160 Gs of force. Like I said, depending on the study, you'll see another range of like 70 to 120. But regardless, we see that cervical strain, sprain injuries or whiplash injuries occur around 5 Gs of force. So let's break this down. Basic math says that 60 is higher than 5. Basic biomechanics say that our head and our brain is attached to our body through our neck. Concussion pathophysiology tells us that concussion is a result of acceleration-deceleration forces that get to the brain, and you can't accelerate the head or the brain without movement of the neck. So if we add all that up, we'll see that all concussion has whiplash. All concussion comes with whiplash. If you've generated enough force to kind of shake and stretch the brain to have a mild traumatic brain injury, you've absolutely accelerated and moved the neck enough to strain and sprain some of the musculature and mechanoreceptors and things up in your neck. But the flip side isn't true. Not all whiplash comes with concussion. And if you haven't caught it yet, whiplash is that injury that walks, swims, and quacks like concussion. So here's a list of the symptoms that overlap between concussion and whiplash. So these are the symptoms that are the same between injuries across multiple studies. We've got headaches, dizziness, tinnitus, or ringing in the ears, irritability, sleep disturbances, blurred vision, neck stiffness and decreased range of motion, decreased isometric neck strength, balance problems, depression, cognitive deficits, and attention deficits. So if you look at that list, this is also studied. It turns out that if we we only rely on symptoms, we cannot actually accurately differentiate between concussion or whiplash. We cannot tell the difference between the two on paper. So that brings us to kind of the final part here is how do we tell the difference? How do we tell the difference between concussion and whiplash? We already know that we can't rely on symptoms to differentiate the two. We can't rely on symptoms to diagnose the two. So as you'll hear me echo all the time also on this channel is that it comes down to finding a concussion literate provider who can do a quality physical exam. So there are things that we will see on exam that will help us differentiate, is this symptom coming from your neck or something else? And with that, we'll see things like your exercise tolerance. You may have normal exercise tolerance with a delayed onset of symptoms. With your cervical spine exam, you might actually just be tender around the neck. You might have joint position error issues where your neck actually doesn't know where it is in space. We might have issues where your neck knows where it is in space, but when you ask it to move and work together with your visual and your vestibular system, that doesn't actually work out so well. And there's other things that we can dive into, but that's for a different video. That's actually for an office visit. The main takeaway from this is twofold. One, rest easy, take a breath. Not every bump, boom, jostle, headbangy kind of incident is a concussion or a proper mild traumatic brain injury. You're a lot tougher than you give yourself credit for. Whiplash occurs around 5 Gs. Concussion happens between 60 and 160 Gs. The symptoms look the same. Not every head bump is even whiplash, and for sure not every head bump is a concussion. The second thing is that when you do, or if you do unfortunately sustain a concussion, we always need to address the neck. In some way, shape, or form, we need to acknowledge that the forces that shook your brain had to come up through the neck to cause that acceleration, deceleration, or that rotation. Now, I help folks with this on a day in, day out basis. If you want to chat with me about your symptoms or your case or your recovery, go ahead and schedule a free concussion consultation with me at the link in the description below. Otherwise, if you like this video and you want to learn more about the neck and concussion, I actually did a live session back in February of 2023 that goes into this in way more detail. Until next time, I've been Dr. Mark. I appreciate you watching.